folks are going to have some choices. And part of the patient protection is that you're going to compare apples to apples for your insurance. You're not going to depend on the spin or the sales and marketing materials that come from different insurance companies alone. You're going to be able to compare what this plan, that plan, and that plan. And that's what this grouping is about. Bronze plans, you'll have a choice of different bronze plans. Silver plans, they'd have a choice of different silver plans, gold, and then platinum. And this sort of breaks down an estimate on how much you pay up front versus how much the insurance pays. And this has nothing to do with the premium tax credits. Okay, this is about how the plan breaks down between consumer financial responsibility and plan responsibility. Yes?
Since the gold plan is pretty much the industry standard right now, are we going to be limited in using that as a baseline when we're talking to
No.
individuals?
I don't think you should look at it that way at all. I think you want to focus on the 10 essential core benefits that are in every single one of these plans. And then let people look at the details of the costs themselves. We should not, in my opinion, be getting into any cost functions with people as far as what their exact costs are. People should be, unless you have been registered with the state and you've become a certified application counselor, you're a navigator, you're an in-person assister, those are the people who have the role of sitting down. And if people need help sifting through the exact financial data of what they can afford and what would be better for them to afford, you know, none of us like to spend a lot of money up front. But some of us understand going to Sam's and buying in bulk, right? Why should I spend $1.25 on one roll of toilet paper when I can get a lot more toilet paper for less, okay? You can say something like that to someone and say, some of these plans, if you have certain health conditions or you choose, you might be better off paying more up front and less when you go to the doctor. I know when my personal insurance changed, and our co-pays went up quite a bit and our deductible went up quite a bit, that made me really think it through. Did I really want to go in to the clinic? You know, did I really want to go in? I knew it was going to cost more. And I missed the days when we didn't have that out-of-pocket cost. So there may be people that it's important for them to understand if you pay more up front and you have less out-of-pocket costs, that might be better for you and your family. But I would put it in the broadest kind of a way, personally. But anyway, these are the different plans, the plan levels, and you're going to have, as I say, the different plans will be grouped into these levels to help people compare apples to apples. There's also a catastrophic plan. As we know, every time we understand something completely, then we add in something else, right? I before E except after C, or sounded as A and as a neighboring way. This is just life. It's just like that. When it gets complicated, it's just like that. So there's a catastrophic plan for young adults under the age of 30. And they get 3 annual office visits and all preventative services at no cost, as of the time that this slide was made. Is that still correct? Haven't had any wrinkles or changes. So what that does is it's a very low-cost plan because they have asked that everyone get health insurance. It makes sense, but there's people who are like, I don't want to do that. I'm so young. I'm so healthy. Okay, well, if you get in a wreck riding your motorcycle with no helmet on, you have to have a catastrophic plan at least so that I don't have to pay for you to be plugged in to a respirator for the rest of your life because you're paralyzed. So this is just an extra way to say very, very low cost. This is, you have to have it. So how you buy health insurance. Here's some new laws for buying insurance. This is in the Affordable Health Care Act. No complicated medical history to have to give. Why? Doesn't matter anymore. Right? Right? So the application itself, if you go through a sample type application, the only question it asks you, sort of a medical history question, is do you use tobacco? Are you a smoker? Do you use tobacco? That's hugely important, and that will change your rates. It also even will ask you, if you're covering children, do the minors use tobacco? Do the children use tobacco? So it's really important. Again, you don't have to wait to hear if you've been approved because everybody's going to get health insurance. Yay. By law, the coverage is guaranteed, even with pre-existing conditions. There's no lifetime maximum limits. We talked about that a little bit. There's clear information about the benefits, and all choices are laid out for you, premiums, deductibles, and out-of-pocket costs. So those are things that are going to really improve people's ability to understand insurance and their access to it. Who? Oh.
Is there a waiting period?
Well, the waiting period has to do with the technicalities of enrollment. It doesn't happen instantaneously. So right now we're going to be in an enrollment period, and I have some slides about that. The only waiting period is the matter of the coverage starts January 1st, and then enrollment's going to continue during the live coverage period for people who haven't enrolled yet, and there will be some lag time between when they apply and when everything gets ready and they can actually start using the insurance. And that'll depend, but I've got a chart about that. Who's tired of me talking? Who wants to watch a video? Anybody? No? You just love me talking.
I've got a question.
Yes.
All right, if you have insurance through your employer and, will the lifetime maximum be taken off of that, or is that still on, the
Yes.
insurance?
What you're asking about is the patient protection parts of the Affordable Health Care Act. Those things are already happening, okay? Like being able to keep a child on your plan until they're 26. That's already gone into effect. Other things aren't happening until full implementation on January 1st, but they do affect people. And that's exactly why I was wanting to show this video. So let's see if I can do that. Yes, exactly. This, I just want to thank Bob again and ITT Tech for letting us use this, because having this little computer right here and being able to do all this is just, I'm so excited. Okay, let me see if I can full screen this, and oh, where's my sound? Oh, I muted my sound. I'm gonna
So you've got private health.
Yay. Let me go back to the beginning.
Let's talk about the Affordable Care Act, also known as Obamacare, and what it means for you. Say you've got private health insurance already. Maybe you have it through your job or your parents. Obamacare means you get a host of new benefits and protections. For example, insurance companies are now required to cover women's wellness visits, mammograms, birth control for women, immunizations for kids, all without charging you a penny more. That means no extra copays or fees. Young adults can now stay on their parents' plan until they turn 26. Insurance companies can't limit the amount of care they'll cover over your lifetime. Also, if your insurance company spends more than 20% of your premium dollars on overhead, stuff like CEO salaries, marketing, administrative costs, they have to send you a refund for the difference. In January, that list of benefits gets even longer. It will be illegal to charge you higher premiums or refuse coverage because you get sick or have been in the past. Charging women more than men for the exact same coverage, also illegal. No more deciphering page after page of jargony paperwork from your insurance company to determine what they will or won't cover. Instead, you'll get a short, plain language summary of your benefits and coverage. Easy, right? You can learn more at healthcare.gov. Okay, what about the folks without health insurance, or people who buy coverage on their own? Here's what Obamacare has for you. A new, simple way to buy affordable, high-quality health insurance. Starting October 1st, you can go to healthcare.gov and use the new health insurance marketplace to see all of the health plans available in your area and sign up for the one that fits your needs and your budget. You can also find out if you're eligible to pay less for private health insurance or whether you qualify for other free or low-cost programs. All the plans in the marketplace are required to cover a core set of essential health benefits: doctor's visits, emergency care, prescriptions and lab tests, rehab for illness or injury, mental health services. They all come standard. Plus, all those benefits and protections available to people who already have insurance: no-cost preventive care, coverage for pre-existing conditions, accountability for insurance companies. You get all of that, too. You can apply for marketplace coverage 4 ways: online at healthcare.gov, by mail, on the phone, or in person. And open enrollment starts October 1st. You can learn more right now by visiting healthcare.gov or calling 1-800-318-2596. So here's the bottom line. Whether you need health coverage or you have it already, the Affordable Care Act offers new rights and protections that make coverage fairer and easier to understand.
It's on YouTube. I haven't seen it run on TV. It makes me a little bit dizzy how fast her hand is moving the whole time, but I really do like it, and I think it does a pretty good job. Let me take a moment to get back where we were. And did it start to make sense to you, the things we'd already talked about, and then you heard it being talked about there, and some things we haven't talked about yet? So some of what they talked about on that is the things that we've already talked about, and they touched on some things we haven't talked about yet in this presentation. And one of those things is the premium tax credits. They did flash very quickly over a number there that 6 out of 10 families or individuals who are going to get insurance through the marketplace are going to spend less than $100 a month for their premiums. Now, it went through so quickly, I keep meaning to go back and look at that again and make sure that I'm saying that right. Does that sound right?
I'm not sure, but I do know that 79% of folks who apply through the marketplace qualify for subsidies to reduce the expense.
Yes. So, and in that video, I believe it said 6 out of 10 will pay less than $100 per month. Let's remember to look at the video again and try to write down some of the most important fast stuff that comes through for us.
Are they saying just the marketplace, or are they also
I
including
think,
the TennCare expansion?
no, I think they're just talking about the marketplace. So, the fact is that many of us in this country don't realize how many people exist within 100% of the poverty level, 100 to 200, 300% of the poverty level. And what this marketplace is designed to do is help people who are stretched pretty thin just on their regular needs to also be able to afford health insurance.